Hello everyone. Good morning, good afternoon, good evening, whatever time this specific lecture reaches you. Today we want to look at adherence, what it is, and what we need to know about it. Okay, because the main focus of treating a patient or giving drugs to the patient or medicines to the patient, we expect the patients to adhere to treatment. Okay, so we want to look at what patient adherence is or medication adherence. So we see that adherence may sound a new term for those who don't know about it, and it moves hand in hand with what we call compliance. Or some people can use it interchangeably, can use adherence interchangeably with compliance. So you find that adherence is a degree to which a patient follows the prescribed treatment plan that you have given to them. We have just had a lecture on patient care, so if you've not yet got it, it is good to watch it before you watch this one, because you will be in position to understand the information you have to give to the patient. How do you care for your patient in case it is an acute infection? How do you care for acute care or offer acute care? And then chronic care. So you need to know that, because if you know that, you're able to educate them on adherence, or they will be in position to adhere if you've handled them right. Okay, so patients always need to be cared right for them to adhere to treatment and comply to medications. So if a patient follows the guidelines or the explanation or information you've given them strictly, okay, on the treatment information you're giving them is on the treatment guidelines or on the treatment plan, please, not guideline, on the treatment plan. Like a patient has come, explained to you the condition, or in case they are coming with a prescription. Like I said in the last lecture, we have looked at prescription care, like patients coming in with a prescription or without a prescription. How do you care for them? So you find that if they have come with a prescription, after you have given them the medication, are they able to comply to the treatment plan indicated on the prescription? Are they able to adhere to the treatment plan? So that becomes adherence. So you need to give advice to your patient clearly for them to be in position to adhere. So we find that is a degree to which we are defining what adherence is a degree to which patient's behavior is in taking medication corresponds with agreed recommendation from a healthcare provider. Okay, so how you handle your patient will determine whether this patient is going to comply to treatment or not. So compliance is the degree to which a patient carries out the physician instructions on how to take the prescribed drug and treatment. So you find that many studies about outpatient compliance carried out in developing countries indicate that only about 50% of the patients follow the instructions that we give to them. Okay, the instructions we give to them, approximately 50% of the patients only have showed compliance to treatment plan that has been prescribed to them, or that a physician or a health care provider has given to them. So there must be something wrong somewhere, either how we are giving the information to the patient, or maybe the patient's expectations are above what we are delivering, or there must be something that we need to do so that we attain at least 90% of the patient's compliance to treatment. Okay, so what are some of the types or categories of non-adherence? It can be a primary non-adherence. We have the patient not accessing or having access to medicines. For example, they are disabled. Maybe your facility has no no space for disabled people, because there are some people who cannot maybe climb stairs, and then you find that there is no provision for them. So you find that a healthcare provider has to go and listen on behalf of a patient, and it will be like a reported speech. So sometimes in a reported speech, you find that a person may not really give you exactly what they told them. Yeah. So secondary non-adherence is when a patient has access to medication but do not take the medicine as directed by a healthcare provider. Maybe due to forgetfulness, like a patient forgets, maybe due to the adverse effects of the medications that uh, these medications get to your patient. Maybe when they feel better, like after taking, if for example, you have a malaria treatment plan, we always know it goes for 3 days. Okay, so that is for acute malaria plan. So you find that you give your patient medication for acute malaria plan or treatment plan, and then they take like 1 day, they comply to treatment 1 day. So in the second day, they wake up, they are feeling like they are better, and they stop taking the medicine. And then when the symptoms resurface, they again take the medication. So you find that that is very dangerous, and that act is called drug, like going on for a drug holiday. Yeah, even drugs have holiday, and that's not a good practice. Patients, this is not a good practice. Always follow the right thing. Do the right thing in the right place. Follow instructions that you have been given by healthcare provider, because these people have been trained to give the best or to deliver the best to you. Okay, so we also look at what are the types of non-compliance. You find that receiving a prescription and filling it, okay, for those chronic care. Like I said, if you have not yet watched our video or lecture on patient care, it is better you watch it first before this. Taking incorrect dose. A patient is taking incorrect dose, taking the medication at a wrong time, decreasing or increasing the frequency of the doses. For example, maybe if I missed yesterday, so I take the medication of yesterday and today together. Then stopping treatment too soon before the duration time that you had given to them. Then we have non-participation in clinic visits. A patient gets lazy to go for maybe refill, maybe review, okay, just because they are feeling better or they are still having medication. Then also there is following instructions failure, okay. When they fail to follow the instructions, it becomes non-compliance. Drug holiday, like I was talking about, having those holidays for this medication, like skipping the days. So you find it's not right. Then white coat compliance in a way that if you're not on a white coat, the patients are not going to listen to you. Like you need to always, like, they feel maybe you're not the right person to give them the information. Okay, we have had cases whereby you are working on a patient, and just because you're not on a white coat, they always say, I want the other doctor, I want a doctor to work on me. For example, if I'm a nurse, and then they'll say, I want the other doctor to work on me. And yet the doctor has given you instructions and the treatment plan for this patient, and you are ready to work on your patient. Okay. What are some of the causes of poor compliance and adherence? So we find that there is improper labeling. So this can be from within us or from a patient. Okay, this can be caused by us, the healthcare providers, or the patients. So you find that improper or poor labeling, when we don't label the medication right, okay, when we don't follow the standard operating procedures of labeling the containers or the packaging material that we are going to use to give this medication to the patient, it is a very big problem. Okay, so it can be neither the name of the patient is wrong, nor the name of the drug that we are giving to the patient in on the container. Okay, so you find that sometimes our packaging material, we have details and then we ignore those details to give to the patients. You find that it gives you the name of the drug and then you are not writing the name of the drug there, or you are writing the name of the drug in abbreviation. Okay, these patients need to know these medications that they are taking. All right, so if two or more drugs are dispensed together to this patient, and the patient does not know which drug he or she is taking because you didn't include the name, and maybe making it worse, you have not included the duration, and then you have not included the dosage, how they should take it, when they should take it, after how many hours they should take it. So you find that it becomes a cause of them not complying to treatment because first of all they don't know what they are taking, they don't know whether it is the right medication for them because the name of your patient is not included there. Okay, so inadequate instructions. Sometimes we fail to give these patients enough information that they need to get or concerning their treatment. Okay, so like I said in the previous lecture on patient care, we find that we had a long list of information that you need to give to a patient. So in case you fail to give this information to your patient, you find that it is a cause of not like not taking the medication right, not responding to the treatment plan that has been drawn by a healthcare provider. So instructions on dosage frequency must be written on the drug label, or the patient could forget because the patients forget how to take it, when to take it, when they arrive at home. Okay, so that can be a big cause. Another one is treatment or instructions that do not consider the socio-economic beliefs, expectations, religious observations, environmental and cultural aspects of the patient. For example, in cases where the patient does not know how to read proper instructions, you would include graphic symbols of how to take the medications. So our packaging material here in Uganda, it has those other labels like maybe in the morning they show a half of the sand, then maybe maybe after 8 hours we expect around one, it shows a full sand, and then in the evening also it shows a half sand or a half symbol of the sun. Then at night, it also shows the moon. Okay, so you would actually then use these symbols to describe to the patient on what they have to do. Okay, another thing that brings about non-adherence or poor adherence and compliance is inadequate counseling. We do not counsel patients most of the time. So that's why we are having 50% of compliance. Okay, so patients need to be counseled on how to take the medication or the indication that they are suffering from. Like they need to be encouraged, they need to be reassured, okay, of them getting better. So we are continuing with the causes. We see that physical limitations, okay, and these are some of the physical limitations. The most prominent one is long distance to the healthcare facility. So you find that a patient needs to refill their medication, but the facility is far. Most of our facilities here are far from from some of the places. So you find that the patient looks at the distance and the rest. So a patient tries to skip some days so that the medication takes longer, which is more dangerous. Okay, drug-related factors, for example, side effects, adverse drug reactions, organoleptics like organ failure and generic variations. There are some patients who take only German brand. So in your facility, if you give them maybe Ugandan brands of the same medication, they don't take it. Okay, so you find that it is a cause of not adhering to treatment because the brand they are used to is not the one you've given them, and they think it is a wrong medication. Okay, past experience with the drug. Some patients maybe got bad adverse drug reactions or side effects with that same medication, or maybe the smell of the medication was irritating to them. Even if the manufacturer has improved, okay, on maybe the taste on those other by adding sweetening agents and what. So you find that the patient already has that memory of when they took that medication like the last time. So you find that a patient's compliance is reduced to medication. Medicine management, where we look at the number, the time, the lifestyle of the patient, the forgetfulness of the patient. This can bring about non-adherence or poor adherence and compliance. Disease-related factors, for example, physical effects, asymptomatic, and then mental state. For mental state, of course, we know that these patients can actually not adhere to treatment. So they need like a care provider who is always reminding them to take their medication. Patient poor understanding. Most of the patients are not illiterate or literate, okay, about, so you find that reading, they cannot read, they cannot maybe internalize, and this brings about much of misunderstanding and confusion about what they are taking. Okay, also depends on the dosage regimens or drug regimens given to them. So what are the consequences of non-compliance? When our patients don't comply to treatment, what happens? What like happens? Yeah, so we see that there is financial burden in a way that they are going to come with the same condition back to the hospital, and they're going to use maybe the same amount of money because what you gave them, it didn't work, in a way that they refuse to follow it. Okay, or the condition is going to get worse, and when a condition gets worse, there will be increased hospitalization, like they're going to be in the hospital for a long time because the maybe the degree or like the care has to be increased because the treatment, like the treatment you gave them, the treatment plan that you had given to them didn't respond. Okay, there is wastage of resources both in the facility, because if a patient, you're giving them the medication and then they don't take it, so you find that it is wastage of resources in a way that the medication they have taken, some other person will have taken and followed the treatment plan. And yet they took it and maybe kept it under the bed or threw it, something like that. Also, the patient's resources are going to be wasted. Your facility resources are also getting wasted. Okay, there is prolonged hospitalization in like I just what I was saying, that a patient will take longer time in the facility and yet they have other things to do. Okay, poor treatment outcomes are going to come up, and then increase morbidity, increase mortality, drug resistance. This always comes because the bacteria gets used to the medication because you're going on drug holiday, so there is a lot of drug resistance coming up just because of non-compliance to medications. Hard to make decisions by the patient, by the healthcare provider. A healthcare provider fails to make a decision because you did comply to treatment, and like it has to figure out another regimen maybe to give, or another treatment plan to give to you, so it becomes a great thing. So factors, what are the factors influencing compliance? We have patient demographics, are the ones that can influence therapy, the route, the duration of treatment can also influence. Okay, if it is taking maybe a smaller time, patient can comply to that treatment. If it is a comfortable route of administration, there are some patients who do not like prefer the oral route of administration, and they prefer maybe the parenteral route of administration. So for such patients, if you give them the oral medications, maybe you are not aware of what they prefer, so you find that they will not comply to the oral route of administration and vice versa. Okay. Then the disease condition of a patient, if not clearly explained to a patient, counseling the patient, you find that it can be a cause of or a factor that can influence compliance. Healthcare systems, the number of healthcare systems that are affecting or influencing this compliance. Socioeconomics can also affect. What are the strategies to improve adherence? Involve patients in medicine selection. Okay, when you explain the indication to a patient, or before you do the treatment plan, share the treatment plan process with your patient. Okay, inform the patient about which route they prefer. Is it oral route? Is it a parenteral route? Like in the whole process of medicine selection, of selecting the right medicine for them, explain the whole procedure, involve the patient. Okay, use of reminder when taking the medications. You can remind always your patient when to take the medications. Minimize polypharmacy, having so many drugs treating the same condition. Okay, combined therapy, try to use a combined therapy. Timely delivery of medicines to health centers, because sometimes most patients can go to the health facility or health center and they don't find medications there. Appropriate labeling and packaging of the medications can improve adherence. Giving patients relevant information. Give the patient information that they need to know about their condition, about their treatment plan. This improves adherence. Use of dosage monitoring systems or compliance aids. You can use that. Review prescriptions and medications. Always do a review, okay? Involving family members and caretakers in this process. Addressing problems linked to drug side effects, and then maintain patient contact and regular follow-ups can improve. What are the measures of adherence to treatment? Pill counting, like always count for your patients the medications. There are some hospitals that they use the unit dose system. They give the patient only what they are supposed to swallow that time, and then another time it is brought. So you find that if the pills are looking few, the patient is encouraged to swallow or adhere to treatment. Directly observed therapy. Observe a patient while they are swallowing or taking that medication. Medical outcomes, and then medicine event monitoring system should be put in place. What are the significance of adhering to treatment? So you see that adherence plays a role in management of chronic illness and other serious health issues. For example, clinically meaningful improvement in patients is realized, okay? Arrest disease progress or worsening of the condition, prevents complications, okay? Adherence packaging helps the patient by visually indicating whether or not medications were taken, okay? Also, a helping tool for family and caregivers. You need to help in following of instructions on medication taking. That is the time, proper dosage, and then that's it. So thank you so much if you came this far listening to this specific lecture on adherence. I hope you practice this or put this into practice. I thank you so much for listening. Subscribe, like, and share to this channel so that we are able to make more videos like this and more lectures like this. Thank you. Have a great time.